Here we are using the Go Disposable Loop sling. It can be used for above-knee amputee and non-amputee patients. We're demonstrating it here for an amputee patient in size medium. As you can see, the carer has folded down the centre of the spine of the sling and placed it on the bed to the centre of the patient's spine for when they roll back onto the bed. The carer brought the sling back a little bit, allowing a small gap so that you can roll in the top of the sling to make it easier to pull through. This positions the sling correctly on the bed, making sure that the base of the sling is at the coccyx. This is now easier to slide the sling through. If one of the limbs is shorter than the other, or it's a bilateral amputee, always place the sling onto the shorter limb first. There are amputee connections up the side of the sling, both in front and the back of the sling. When the first part goes on, it goes on the inside, and when the second part goes underneath, it will go on the outside of the far side of the sling. With the Go sling, we have made the leg loops slightly longer, so in this case they'll be short at the back and long at the legs to get the patient into the proper seated position. The carer ensures that he attaches all 4 loops and making sure that the amputee sling connections are being used on the actual side of the sling. The lower part of the sling can also be removed to allow you to toilet while sitting on the chair. As you can see, the sling gives good head support. And now the client is in a good seating position, and the carer will bring the client across to the chair and position them onto the chair. Now we'll demonstrate putting a medium amputee sling on from the chair. The client in this case is quite able and fit, and they can hold on to the chair. The sling is placed down to the coccyx, and again you would use the shortest limb first to make sure that you've caught the hips of the client by bringing the sling right underneath and tucking it underneath the hips. Again, shortest limb first if it's a bilateral amputee patient. This will go through into the top loop, which is your amputee connection on the inside for the first loop on. And then the next loop goes underneath the leg piece and will go on to the outside amputee sling on the back of the other side. We're using all the blue connections as per the instructions of the sling when used as an amputee sling. And as the patient gets lifted, the sling will gather underneath the person's hips to give them a comfortable, safe lift.